Turn your phones off.
Mine's
All right.
in the other room.
Hi, everyone. Dr. Corley, Faruqi, and Kiltz. Hello to everyone. We're trying to get us all in this, and we're going to squeeze in today. Hope you guys can hear us all. And I've got the A team here today answering your questions, talking about this crazy fertility journey, and hoping that we can enlighten ourselves to a better way to help you on this fertility journey. And let's see, Amber, let's see, Carrie, trusting the journey. Hello to you guys and welcome.
There's Pega there. Hi.
Yeah.
Yes, Pega, Bellissima, Vicgo, Nima, Danielle, hello, Duchess, and Sabine, hello and welcome. Let's see, Sunday. Tomorrow's November 1st. Today's Halloween. We're wearing our costumes, by the way. These are just costumes. Right? I'm actually Corley. This is Faruqi, and that's Kiltz.
Hi, everyone. Hey, how come we forgot to wear costumes?
Well, no, you did, but we did.
They did. They just
It's
can't
an
say it,
amazing morning. It's gray outside and rainy in upstate New York, foggy. And Dr. Corley and I were talking. I get my booster on Thursday, and I was feeling under the weather. And it's kind of one of those under the weather days. And I'm just going to relax. I think we're all going to do that. Let's see, North Dakota. Hello. Tell us where you're coming from, by the way. We're really, really excited to be talking to all of you guys. Linda from Rochester, Evelyn, good morning. Jana, Florida, Sarah. So, Dr. Condrip and the team is open in Sarasota. See My Fertility for monitoring. And I've been working here. Hand me that piece of paper way over there, the white paper there. I've been diligently working on the plans for the lab in Sarasota. So excited to get that going forward. And we're moving forward every day, right?
Yeah. That's correct.
All right. So maybe let's see, Colorado Springs. Good morning. I think I saw some questions there. Consult with you, MS Seguen. Again, we're really grateful. We're going to continue affordability, quality access, and we all do things a little differently, by the way. But that's because we're taking care of all of you guys a little bit differently, and they're not so far off. And whichever protocol one of us puts out there, we each individually believe they're important for you guys. So yes, we do them differently. That's just the nature of all of us.
Well, first of all, you got to know that when you're at the forefront of what we're doing, nothing is written in books.
No.
Right? By the time it's written in books, it's already too old. Too old. So between the three of us, how many years experience we have?
Wait, let's see, guys. Let me make sure. Hold on. I got it up. Let me up the volume here. Make sure you guys can hear me. I'm hearing. So can sound still off?
No sound.
Oh,
No
no sound.
How about let me try this? Hold on, you guys. Let me try something here. That looks okay. Let's get back. Let's see. How about now? Is the sound back on Instagram?
No sound.
No sound. Hold on, guys. We can't hear.
Do we have sound on Facebook?
Can you guys hear us on Facebook, by the way?
There's sound on Facebook. All right.
There's sound on Facebook. All right.
All right.
One other.
Still no sound.
Well, we have one other thing to do here. I'm going to sign off and come back on something. If you sign off and come back now, delete video, discard, we'll come back here. Let's go live again. Thank you, everyone, for being patient for the digitally disabled. Digitally disabled. All right. I do have.
There are wires everywhere.
Yeah. Do you have sound now?
We're gonna give it one more time. We got a live video here.
Sound?
We're checking for sound on our Instagram. Please go 1 or 2.
I can hear you now. Yay!
All right.
Just rebooting.
We're just rebooted. That's all it took, by the way. You guys can hear loud and clear, by the way. All right. Dr. Corley came up with my plan. My Neupogen just came in, so I haven't been doing it like I was supposed to, but just starting 6 days before transfer. Is that okay? And will that still help?
Absolutely, absolutely. You start it as soon as you can get it. If you can start it when you can start it earlier, great. But you got it now, use it.
And Dr. Corley reminds me that using the Neupogen early, we can get that out of the way.
Yeah.
Well, we get that out of the way. Or come forward.
Like that. Yeah.
We're trying to all be comfortable.
I look so short.
We have to have humor in all this. So once you get the Neupogen, get it started. We use it both in stimulation. We also use it for transfers and prepping also.
Yeah. Dave, do you do Neupogen, intrauterine Neupogen?
I occasionally do. I like it. I like it injected too. The Hcg Intrauterine I really like. The PRP I like.
Yeah.
I mean, it all works.
So Neupogen also intrauterine, sub-Q. It helps with lining development along with PRP and Hcg. So start it early. So I think those are really good.
I got a good question right there.
Yeah.
Also good is 6 weeks pregnant, and she's asking when can we stop the immune drugs? There's no immune issues. Well, first of all, if you're pregnant and we use immune drugs, there might be immune issues that we never. That's the big problem.
There's always an immune issue for everyone, by the way. So this isn't.
Now,
and no specific test, unfortunately.
No, that's true. There really is no test to confirm or not whether you have immune issues. Let's see. Let's go around the two and see when do you stop the immune meds? If there's documented.
Usually about 10 to 12 weeks, we'll start weaning you. But in many cases, we talk about going even longer, 18, 28, 36 weeks. So I like to individualize it. And that's the best way to approach this.
And the patient's history is most important. Exactly. If someone just has tubal ligation and that's why they're doing IVF, that's one category. If someone's having 2 years of infertility, that's a different category.
Or if someone's had 4 or 5 miscarriages,
correct.
Now we're going to stay on that for quite a long time.
Yep.
Jamie's talking about 9 weeks, 5 days, loose bowels, very miserable right now. You may have a virus going on that's not normal. I've kind of felt that way after my vaccine the other day. So there's a lot of stuff going on, viruses, bacteria, yeast, and other microbes that may be a factor, or endotoxins from the microbiome or something you eat that may be part of that. So I think it's real important to get checked and don't make any assumptions on that.
Hey, hi, Kelly. Hey, all the patients, pregnant patients are on.
There are a lot of pregnant patients out there, and tell your story. Share them back with us. Really important that the story is told.
Because it's like paying it forward.
It absolutely is. And whatever you did is important. Plus, we're a village. We're a family. We're a group of lionesses and lions sharing the pride of the successes. And we're all working to help all the other lionesses and lions find the success they're looking for. What percentage of embryos miscarry? I had a PGS embryos miscarriage with untested in May, and now I'm pregnant with a PGS normal, hoping she is my rainbow baby.
She will be.
It's very good.
Very good sign there.
Very good. You know, there are some normal embryos that miscarry and abnormal embryos that go on to term. So we don't have a straightforward answer, but stay on your meds, stay Kiltz's crazy keto as much as you can, whether you're a vegan or a carnivore. It's critical throughout pregnancy. I think it's really important, but stay on those meds for sure.
I'm having an issue with blood pressure. I'm so anxious. What do you recommend I do?
Well, let's see. Talk to your doc. Check your diet. Low-dose naltrexone. If you need to be treated for that, I think it's very important. There's a lot of inflammation, stress, and struggles. You know, this is where I think medication, prayer, and yoga can help. Keto diet can help. Low-dose naltrexone. But if you need an antihypertensive, we can help you. Primary care can help you.
Your OBGYN.
Your OBGYN can help you for sure in that. But don't go without making sure it's taken care of.
Yeah, because that's there's a reason why they call it the silent killer.
It needs to be taken care of. Hypertension is a sign of inflammation. It's as simple as that. It's vasculitis, vascular inflammation. So it's acute and chronic. You want to take care of it and not ignore it for sure.
Dave, how does Hcg wash work?
That's from, who's that from?
Marie.
Marie.
Yes, the exact mechanism we really don't know. We do know that there are Hcg receptors in the uterine cavity, and it was just, we tried it. And when I looked at the data, when I came here 6 years ago, I saw that those that used it had about a 20% increase in pregnancies versus those that did not use it. So there's something about it that works. Exact mechanism, I really do not know. No.
It enhances the receptors to be in the I'm pregnant mode and sort of say, come on down, right?
A lot of our patients say,
So
yeah.
Shout out to Dr. K2, Dr. Condra, down in Sarasota. Really grateful.
Yeah, so that was the scientific explanation from Dr. Kiltz why Hcg works.
Yes.
Thumbs up.
When did you check for endometriosis? Rowie Wolf. Hey, Rowie, how you doing today?
Endometriosis?
Now, and basically infertility is an inflammatory condition. Endometriosis is a common cause of infertility. So it may be worth checking it early or after some treatments or after failed IVF. Your choice, but infertility is a sign of endometriosis, in my opinion. And I think getting it checked early on, talk to your gynecologist. Any other thoughts?
Yeah, I was going to say, when we have new patients, new clients coming in, they've never had infertility treatment, I always say do 3 to 4 weeks, 3 to 4 cycles with your IUIs. If that fails, then we have you set up for potential laparoscopy. Because if the endometriosis there is treated, it's going to help you with IVF as well.
Yeah.
All right, Dr. Corley, I'll be seeing you Friday for an FET.
Excellent.
Get Sarah McManus pregnant. And all of us together, remember, our vibration and prayer energy is, I'm getting pregnant. I'm pregnant. I'm pregnant. I'm pregnant. All right.
Well, everyone is pregnant. We just don't know when.
That's
every one of you will be pregnant.
Fertile is the real energy. And check out my book, The Fertile Feast and The Fertile Secret. You might get some really great stuff there. All right. Let's see. Good morning. The check hurt me when trying to do SIS because it was placed a second wrong. Help from OB after that. I couldn't get the tube through my cervix. Sometimes we'll do that under light anesthesia in our Syracuse office. We can help with that. Or laparoscopy, hysteroscopy may be worthwhile to evaluate that. But
with the dilating of the cervix that you do with the hysteroscopy, a lot of times that will help. So,
Yep. Lots of different ways. Every single test and nothing wrong. Janine, Marie,
Mingo.
Nothing wrong, no endo, no inflammation, nothing. And for some reason, I've had 4 miscarriages, 2 failed FETs.
Well, that's quite a bit wrong here.
So you have something wrong. Infertility is the foundation of health and wellness. You have inflammation, by the way, but we're just not very good at identifying it. So where does she go? What's your thoughts, doctor?
Well, I don't know if you've had some immune testing. We just said that there's no actual immune test for uterine problems, but usually
together all the tests may help.
Exactly. So we test around other immune issues, and then we kind of extrapolate that there might be actually a uterine immune issue. That's one thing you could do. There is an actual workup for recurrent pregnancy loss. By the way, the failed FET is probably also recurrent pregnancy losses.
Well,
potentially.
This is where the ERA, laparoscopy, hysteroscopy,
yeah.
Pregmune testing. Look at pregmune.com. You might want to get that testing to look at that. Receptiva DX. What about the scratch procedure, Dr. Corley? What do you think on that?
Well, there's been just a lot of data over the years, especially from nurses, that if they could not get pregnant, this is back in the 60s, they'd say, I want a DNC. And lo and behold, I know some friends of mine that every time they got a DNC, they got pregnant. I'm not saying that helps everyone, but that's the philosophy behind the scratch.
So there seems to be some value. And
Do you know how they found out that the scratch worked?
No, I don't.
There was this researcher in Israel, and he was looking at endometrium, and he's saying there must be something different in the endometrium of women who get pregnant as opposed to those who don't. Actually, he found nothing different, but he realized that when he did the endometrial biopsy, those patients got pregnant. So
well, and if you think about it, when you debride a wound, it helps with healing.
Yeah.
So it's the same thing. We're creating some inflammation to help the healing process, which improves implantation. And so the problem is,
truthfully, we have no clue of any of this.
we're all making it up, by the way. But the truth is that scientific data is only a guess at the moment. But you don't have time to wait for the science to catch up and be able to tell us the real answer. Truth be said, what we're doing is we're all looking at ideas that so many people have brought to the table here that helps. Some people will get pregnant with IVF, deliver a baby, and then get pregnant naturally. What happened? Don't know, but I know it works. All right, let's go over here to YouTube and Facebook. I'm on Boosters, third beta, 364. All betas have been more than doubled. Is that okay? Ultrasound Tuesday. What should I expect? Kayla. Well, number one is HCGs don't always double, so you can't use that as a guide. As long as you got a positive, stay on your meds, get an ultrasound at 5 weeks and 6 weeks. At 5 weeks, you see a sac. That's all you may see. You might not see a fetal pole.
Right.
At 6 weeks, you should see a fetal pole and usually a heartbeat. But by 7, you should see a heartbeat.
Yeah.
But stay on your meds, stay on your meds, stay on your meds, and remind all of our team members the HCG is not that good to tell us the absolute answer to that, by the way.
Yes, just a guide.
That's
just
right.
a guide.
Right. Vixen Girl 6. Dr. Corley, why don't you handle that one?
I can't see it.
Oh, 6-month-old, seeing my baby retrieved at age 40. I want to do another retrieval at age almost 42.
42.
So you're 41, AMH
Yep.
0.67. Does she still have a chance?
Absolutely. 0.67 is not bad. Actually, it's just consistent with age, but you've got a great chance. And you've got the positive proof. You've got your child.
There's no number in anything in science that will give us the answer. You must have faith and always move forward with faith.
And honestly, we have some patients that we did stimulation with really, really low AMHs, producing 3, 4, 5 follicles.
And making babies.
Yeah.
And making
And
babies,
you
by the
figure
way.
that one out. And we have other ones with high AMH producing nothing.
So
the other thing with AMH, it doesn't necessarily say you've got a good or bad egg. It talks about, it's kind of the quantity that you may have. So lower AMH will have usually less eggs, but not necessarily bad eggs,
Exactly.
which translates into good.
is everyone doing good on this beautiful Halloween day?
We need the mask.
We do.
You have nothing, no costume, nothing here.
Nothing. Let's see, Kelly. Let me see if I can get Kelly's stuff here. I apologize. Transferred 2 good day 3 embryos. Betas Tuesday. Home test is giving negative. Feel so defeated. Don't give up. Stay on everything. And let's see. I have endo. Don't give up. If what you're doing isn't working, we got to change it up and do something else. That's the truth.
Now,
right?
here's where the other patients who got pregnant need to tell their stories, because
Right.
there's a lot of people just like you who have become
Same
pregnant.
history.
Yes.
Pay it forward. Tell your stories. Help your other friends, your sisters who are doing the same thing.
And don't forget the
Yeah.
Fertile Spirit with Danielle and Megan and many other team members. And we have so many people sharing the energy of helping people. The Fertile Friends is so important, by the way. So keep at it. Go to our website. Look at, again, the Fertile Spirit. Look at our drkiltz.com, seeing my fertility, seeing my healing arts. All these are arenas. And there's a support group that you guys handle on Facebook that we don't have anything to do with, but sharing our thoughts and ideas and better energy, all of us together, by the way. All right, let's see. Serendipity designed positive. You know, we love your positivity too, by the way.
Yeah.
But look at,
By the way, how did we become positive? Because our patients taught us.
yes,
to become
they
positive.
absolutely did.
Yes.
And, well, you know how we learned how to be positive? Because we had a lot of negative issues in our lives. And so if you don't have problems, you're never pushed forward. You must be pushed in order to find the light. And I know that that we talk a lot about faith in that higher power, no matter what you believe it is. It's so critical for all of us in life, by the way. Oh, who's the doc in Buffalo, by the way?
Do you know who he is?
Doc,
I know he's a nice fellow.
oh, he's a really good guy. Dr. Chang, Dr. D'Souza. Oh, by the way, and the real boss there is Chris Z, right? Chris Z, amazing. Buffalo team's amazing. So keep at it. Don't give up. You got to read, listen, watch something positive every day, and you gotta love, right? Love is the critical thing. You must look in the mirror and see love within yourself, no matter the size, shape, whatever it is. Love thyself. And then I've got to love Dr. Corley, and I got to try to love this guy. He's hard though. This guy's easy to love. Very easy to love.
I love him too, by the way. And I don't know what
I'm surrounded by love.
Yeah.
Katie DeLeo, let's see, had a baby. And how long after a baby can you do another transfer? Now,
Whenever you're ready. Really.
I say at least 3 months, maybe 6, but probably it depends if you had a vaginal or C-section. My brother Thomas is 10 days shy of a year younger than I am. Right?
Thomas is older than you.
No, Thomas. He acts and looks older, but
I both thought he's older.
Mom was pregnant just 3 months after I was born. Like, whoa. And then
Especially if you're breastfeeding, it usually takes about that amount of time anyway.
Yeah.
right. So I would say 3 to 6 months is a good number. Remember, stay keto, stay positive, and believe that you're having another baby, by the way.
Vixen Girl says a doctor said 1 year, but I have a C-section. You know, a lot of our patients are slightly older. They had a little bit of challenge getting pregnant. I wouldn't waste
You
time.
mean the 90-year-olds?
Yeah.
No, okay, just get going. Just get going. Right.
Exactly.
The year's too long, by the way.
Yeah.
Vanessa Rodriguez is sharing the ladies. Feel free to join the CNY Facebook support group. We need more of all of us.
Yeah.
Again, no matter what fertility clinic you're going to, the CNY Fertile Way, and check out our family building guide. I lost the magazine or something. That's my quick. I printed the page so you know the CNY Fertility Family Building Guide. It's my best. But we're adapting. You have to adapt to everything. And don't forget, what can I not talk about?
Keto.
Keto, right? Kiltz is keto. And really excited. We're working on some keto snacks and Kiltz's keto concept. I don't know. It's really crazy ideas that we're just having fun with. You must have fun all the time, every day, even though it's really hard. It's really stressful. And if you're feeling stressed, just let us know. Let our nursing team know. Let our front office team know. And when you're talking to our global team or financial team or whoever you're chatting with, let us know what your needs are, and we're here to help as best we can, by the way. All right. Ultrasound, 5 weeks, 5 days, gestational yolk sac, no fetal pole. Hcgs are rising. My nurse was not hopeful at all with me. All right. Nurses, team members, hold the hope. Be positive. Come on, guys. We all you got to hold the hope. Sometimes we've been taught in medicine, I'm going to prepare you for the worst case scenario, right? I mean, come on. Don't we want to be continuously focusing on the beauty and blessings of the great things that are going to happen in our lives, whether they happen today, tomorrow, or next year, right? We got to be prepared for all that.
And what your mind thinks can affect what actually will happen. So if you have a negative negative output, things change in your body. Hormones change. There's more stress hormones. There is definitely less success. So I would be positive.
So I wrote a book called The Fertile Secret, which is taken from The Secret from Rhonda Byrne. If you haven't listened to it, watched it, or read it, you must. And my daily intentions and inspirations and all the things that I have to work on every day. Otherwise, I'm depressed, I'm sad, I feel down, because that's how I can be. So why do you think I work on positivity all day long? And Tia says, you're always positive, just like, come on. Well, I have to be this way. Otherwise, I go downhill. So stay as positive as you can. some knowledge on ovarian rejuvenation. Tiff Crowell, kid's mom, right?
Yeah.
Crowell's
kid mom.
mom.
Yeah.
Ovarian rejuvenation. Dr. Corley, what do you think about ovarian rejuvenation?
Well, what I say is we're using it, and there are patients that seem to benefit. Again, the data we're still collecting. I'd love to say we've got this or that. We're getting there, but we do have patients that are responding to it. So there is something to it.
And this is where things like acupuncture, today at 11 o'clock, by the way, Jennifer Waters is going to join me, and we're going to talk about photobiomodulation, some little discs or patches that may help with that, and acupuncture, massage, and diet changes, but things like PRP intra-ovarian, PRP intrauterine. There are lots of things we talk about. Maybe DHEA. I'm not sure I'm allowed to talk about it, but maybe our ovarian bloom supplements. Let's see. I think I've got check out our molecular fertility ovarian bloom. And also Dr. Kiltz's nutritional supplements, our liver supplements. For those of us that don't like to eat liver, the supplements may get you past it.
And the other thing, for those that don't know what PRP is platelet-rich plasma. So it's using your platelets and the healing power of your platelets going back into your ovary or into the uterine cavity to try to help. So it's using your own blood, actually.
And so that's drawn usually a couple hours before we do either the intrauterine or the injection into the ovary. We are recommending antibiotics for to at least 10 days to 2 weeks, given a dose prior or when you're actually treating with the PRP. And then for that 10 to 14 days, there's a slight risk of infection anytime you inject a needle into the ovary.
But there's a little sideline that we could talk about, because when you're talking about ovarian rejuvenation, you're basically looking to produce more eggs,
or improve the environment that we get better quality eggs.
There is one treatment that we do that we actually see frequently that this phenomenon happens is sequential stim.
Right.
What do you think about that, Dr. Corley?
Well, absolutely, I believe in sequential stim, especially for those poor responders, for whatever reason. Maybe it's the regeneration, the regrowth that's happening after a particular cycle, but it does help. Again,
well, I know Dr. Faruqi talks about stacking. We use dual and triple stems, but quite often just the do a stem, the ovaries building the receptors and building the blood flow, which is reducing the inflammation. So I think that's really, really an important thing.
It really spools up the ovaries.
Yeah.
All right. Esposito and McCabe, hello. How are you doing? It's our pleasure always. Now patiently waiting for Friday to come back for a blood test. Awesome. 2 retrievals. Diana, let's see if I can catch this. Sometimes it moves so fast. 2 retrievals after transferred 1 euploid embryo Thursday. What can I do to help embryo stick this time? And what can I do to be more successful if this fails? So basically, our immune protocols, 3 and 4, I think important. Stay as keto as you can. Acupuncture, massage, weekly intralipids, and having lots of faith.
At the most fundamental level, just don't give up.
Yeah.
Keep at it. And
we have we have a really good question there, but from Dr. James SK. What do we guys think the pros and cons of PGT, especially with low embryo numbers? You know that every time we do a Facebook Live, that question comes back. So, Dr. Kiltz, what do you think?
Well, So every time you biopsy an embryo, you're going to get a different cells that may give different answers. They may or may not be right. I'm not a big fan in general of testing embryos. You make embryos, and every embryo should get a chance to get in a uterus. So the more embryos you have, though, and if you're trying to say, okay, I want to put the more likely embryos, if you have 5 to 10 embryos, you're trying to sort of limit to that one transfer, get some testing. It's going to add to cost. You may or may not make blastocyst embryos, so you must make blasts. So if you don't make blasts, I wouldn't try PGS testing the next time, but you're going to have to do another time. So in general, we support it if you wish to do it, for sure, right? And we do a lot of PGS testing. The fewer embryos you have, if you just put them in and give nature a chance, that's my general recommendation. So,
and I was going to say the other thing about the test itself, it really is only saying that the embryo or the cells they tested has the correct amount of genetic material. It does not say the quality of the genetic material. So you can have a PGT normal embryo, but that's not necessarily a normal embryo.
Yeah.
Or it is a normal embryo, even if it says it's abnormal.
Because at the end of the day, we're not even testing the embryo. We're
Right.
testing the cells around the embryo.
Dr. Corley was a normal embryo. Dr. Faruqi was not a normal embryo.
No.
So that we do know. And I for sure was not normal.
Thank God that when I was born, there was no one testing.
Ginger's girl 18. My first FET implanted, but my beta stayed low, doubled 3 times. So we're dropping 4AA. Is that more likely my body or embryo? Also, can I go right into a new cycle? You can go into a new cycle right away, but you might look towards laparoscopy, hysteroscopy, Receptiva DX, by the way. We can do it at all our centers. The ERA, peak testing. You can fix the soil. You can't change the embryo that we know of today, right? And so imagine every embryo you have is a valuable entity. What can we do? So that's where you go to Family Building Guide and look at the immune protocols, look at Kiltz's keto, look at that carefully, read through our website, go to see my fertility, a lot of stuff there. But if one embryo fails, what do you do?
Well, the one thing is, and it's hard with this kind of with us sitting here talking, listening to you, because we don't have a chance to review a record, and the repetitive cycles tells us a lot of information, and we can use that to help predict what's going to happen with the future cycle.
But in general, Dr. Corley, if a patient's not on metformin, do you recommend it? And tell us why you recommend it.
Well, when I recommend metformin, it deals with a lot of times a pattern of eggs or embryos, well, actually eggs that I see it with IVF cycles. If I see a pattern to where you're not getting a lot of mature eggs, it seems that you treating with metformin tends to increase the ratio of better quality eggs, which then translates into better quality embryos.
And I have the same experience.
But if you have good quality embryos, the uterine environment may be adversely affected from a hyperglycemic environment. And so there's a lot of metabolic syndrome, prediabetes, PCOS like that. I know that Dr. Corley really likes to work aggressively to try to focus on reducing the glycation damage, reducing the inflammation, and that also can be very, very helpful.
So it is a twofold: helping the eggs, helping the environment.
Yeah, absolutely. That environment is really,
which is actually why keto diet is so good, because it has.
I'm sorry. Say that again. Kiltz is what? Kiltz is what?
Keto diet.
Kiltz's keto diet is so great. Again,
yeah, because it does reduce the glucose levels, like glycation.
Well, by reducing glucose,
yeah.
the glucose keto ratio it's an index that Thomas Seyfried talked about, and I think it's really important that's why fasting is lasting. And so many animals fast, and human beings typically didn't get food probably for days on a regular basis. We're eating 3 to 6 times a day, which ultimately increases our glucose level, glycation, and the damage. That's really important. Do you suggest strict keto starting now, even if you're doing, let's say we are doing reverse IVF in January, getting pregnant for like every human being from birth to death should be on a Kiltz's ketogenic lifestyle diet. For me, if you're vegan or carnivore, it doesn't matter. It's 1 meal a day, high fat, and cook the carbs well to simplify them. Complex fiber carbs are deadly, in my opinion, for the human. Ferrari and lioness and lion, by the way.
And one of the things I'm always telling my clients, which they'll tell you, the diet is the basic unit. That's what you do. The others, metformin, it's a Band-Aid. It's for short term. The diet's for life.
And Dr. Corley he did keto. We're all working on this together. And our next is a challenge for all of us. 30 days, Kiltz keto. That one meal a day, water, no wine, no alcohol for 30 days. And I've been doing my light exercise in the morning, 4 o'clock in the morning, even 3:30. I ride my bike, nice and easy, some light weights. It's just a little bit of a challenge for me. I did get an extra 20 over this 2 years of COVID. And I'm a little neurotic and crazy also, by the way. Duh, right? Let's see, 42, third open myomectomy recommended to me before last, largest fibroid, entering uterine cavity, corneal region. Shall I take the risk and transfer or do the surgery? You have a large fibroid,
Do the surgery.
get it out.
Yeah.
And you got to look at Kiltz's keto lifestyle, anti-inflammatory protocol, right? AIP, Kiltz's AIP. I think we're going to call it the anti-inflammatory protocol. My bias is it's a kick-ass amazing. Fibroids are caused by inflammation. And, the more you look at it, the more you do it. Don't we feel better?
Yeah.
I know.
We all feel better. Look at Dave Osprey's. It's the Bulletproof Coffee. And we're going to invite Dave Osprey at some point to talk at our 11 o'clock conversation on keto hacks.
Rob, this is a question. When are we doing IVF in Florida?
I'm looking at March, but it might be June. Chris and Johnny and CJ working with the team in Sarasota. I've completed the plans. We're going to get moving. Really excited to bring our affordability, high quality team approach, family approach. That's really it. And integrating Eastern and Western medicine. So we're really working, and I'm working with Dr. V in Atlanta to get frozen transfers, but we got to get this thing going in Sarasota for sure. All right, Anna Giffen, how normal is it to measure behind at second ultrasound? It's pretty normal. You can't go by these measurements. There's a week in the first trimester, an error of 1 week, second trimester of 2 weeks, and third trimester every 3 weeks. So lots and lots and lots of faith is the key to all of this.
And early on, when you're measuring, we're talking millimeters, tiny, tiny little increments.
Yeah.
It doesn't take much to put the little caliper just a little one side or the other, and that completely changes your days. So that's the problem.
Hcg 1001, big issue, thickening my uterine lining. Do you think that the Kiltz keto diet will help?
Absolutely, but also a hysteroscopy if you haven't had one.
Take a look inside, even a laparoscopy or treat. So the 2 months of the anti-endo or laparoscopy, the antimicrobial and the antihistamine protocols, I think, are big. Kiltz's keto, low-dose naltrexone, and this is where adding PRP, Hcg, and Neupogen washes, along with Viagra, may be helpful in this. But if it's not working with all these drugs, take the drugs away, back off, do more natural. And by the way, CMI Fertility, we do lots of natural IVF, natural frozen transfers, low dose medicated. I love, and I know Dr. Faruqi and Corley also love a little bit of letrozole, 220, in those people that have lowered ovarian reserve may be helpful because you don't need all the drugs, but less may be best.
Mm-hmm.
Now, and again, if one thing isn't working, we're going to look to do something else. That's really the key to all of this. Same nurse throughout the entire FET. Hannah's, when you talk to the nurses or you're in the office, at any office, ask for the nurse you'd like. We're not always there at that time you need us, but we're going to do our very best to make sure you get what you want in all of this. All right, let's see. Kayla, can you explain how boosters work and how much they affect HCG levels? Can you find a way to make intralipids taste like chocolate while inducing? That's a good one, by the way. Hcg boosters help the luteal phase. either the receptors in the uterus or the progesterone stimulation, although studies haven't confirmed that. I think we use 250 units a sub-Q shot daily. It brings it up about 20 to 30 units a day, but stay on it. Some of us like it, some of us don't. It's not harmful, but it is going to show a positive when you might not be. But again, be open to this. Just tell the nurses, tell the doctor, this is what I'd like to do. And we will accommodate you on your drive. And if you've gotten a protocol from another doctor, we'll be glad to look at it and help you and help guide you with it. But you have to tell us what you need because we are not very good at mind reading.
Hey, there's someone saying, Dr. Corley, nothing but amazing things to say about you. Thank you for your positivity.
That's my mom. Thank you.
Dr.
Thank
Corley,
you.
amazing. Sarah, let's see, unexplained fertility issues, a low BMI, but regular cycles and confirmed ovulation. OBGYN recommended weight gain. Keto is a high-fat diet. You need more fat in your diet because most people are not eating fat. Fat will reduce inflammation and help you get pregnant, by the way. Let's see. BMI and fertility correlated, fasting keto would interfere with weight gain. But Kiltz is keto. Have you tried my ice cream? You have to eat the fat. It has twice the calories. It does add a little bit to the BMI. But listen, one meal, two most. But we are eating carbs and protein and no fat. Carbs and protein have half the calories. And for some of us, we have higher metabolic rates and we are naturally leaner, but you must eat the fat. Historically, for the last million years, we ate a ton of fat. And in the last at least 100 years, we're not eating fat. We're eating bread. Wheat, bread, salads, vegetables, fruit, fiber. We're eating our birth control. It diminishes sperm and egg quality. It diminishes ovulatory function, and it inhibits implantation. So it's really stupidly simple. And that's why Kiltz's keto is kick-ass amazing. Add the fat. Okay, eat 2 meals a day, but do not graze. And seeds and nut oils or seeds and nut milks, in my opinion, are deadly for the lioness, the lion, the Ferrari. That's the most important thing I've learned in this process. We love you, Dr. Corley. 10 years of no success and 2 retrievals, transfers, and all took was 1 with you and CNY. The best. So we're blessed. Let's see. Small fluid in the cul-de-sac, large ovarian cyst 4 centimeters. Should we drain it? Should we go in and remove it? Or should we just stimulate it even though it's there? All 3 of those options are options, in my opinion, by the way. These cysts are so common. Remember, inflammation causes cysts and fibroids and infertility and all these things, and repetitive failed implantation and losses, by the way. So
usually a simple draining, though, can help too. So, and that's simple without going through any other kind of surgery.
A drainage.
We could drain it even during an IVF procedure.
We do all the time. That's why I recommend stimulation. Dr. Corley is primarily in Syracuse with me. Dr. Faruqi comes to Syracuse. He's going to be at our other offices. Dr. Chang's primarily with Dr. D'Souza. Thank you very much, in Buffalo. Dr. Grossman and Ditkoff are in brain fog in Albany, and Dr. Verdialis in Georgia, Dr. Fink and Dr. Magarelli in Colorado, and Dr. James K2 Condrup is in Sarasota. Find out I have autoimmune disorder. Do you recommend mini IVF?
It's definitely a viable option for you, and it's the most cost effective.
So if you look at the family building guide, we'll talk about the natural, mini, standard, and high dose protocols. All those are reasonable. You have an inflammatory condition. There's no such thing to me as autoimmune. Your body's not attacking itself for no reason. It's because some antigen has gotten in your body and it's causing inflammation. So by removing that environmental factor, that's why the keto is a kick-ass. It's a very narrow, in my opinion. I think it's really important. But yeah, we do a fair amount of naturals in mini doses for sure. And don't forget, immune 3 or 4 for almost everyone. 1 and 2 is not for 99.9 of our IVF or frozen transfers or even our IUI patients. So reminding our global team, our nursing team at all our locations, immune 3, immune 4, IVIG is in 4, and look at Pregmune, Pregmune, for more information on whether you want to get more detailed testing and all of that, by the way. Maria, second retrieval, all follicles are different sizes, got 1 egg. What can I do to make sure next cycle are closer? 42 years young, a 1.5 AMH, low dose, third immune protocol. Stacking. Serial stems, either luteal phase or with your next cycle right away.
Or dual stem.
Duo, triple, or stacking. We have different language. We're from different parts of the world.
I call it stacking.
Stacking. He likes stacking, duo, and I do serial stems. I'm a serial crazy man. Lady Bree, Rint, how are you doing? We're really, and follow us, like us, love us, care for us, because we love and like and care for all you guys. We're trying to share the energy, the knowledge, the information, because if so many people can learn these things early on, they're going to conceive and deliver a baby. Or freeze your eggs, sperm or embryos early on, by the way. We shouldn't be waiting until our mid to late 30s or 40s. In your 20s, maybe the next level is even earlier in your teens, by the way. What do you look at to see why an FET didn't work, especially after it worked 2 years ago and gave me a beautiful daughter? Awesome.
Well, that's a very, very large question.
Well, but in general, it's our kind of getting back to our standard. Yeah. What are we doing? We're going to step back. We're going to look at your hematologic, metabolic, inflammatory laboratories. We're going to maybe recommend a laparoscopy, hysteroscopy, a scratch, ERA, ERP, Receptiva. We're going to talk about different protocols. That's where Dr. Corley is going to talk for sure about whether you should be on metformin or you're looking at keto for everyone.
Well, the other thing too is one thing I think everyone needs to bear in mind is that when you do a transfer, it's a 50-50 shot. So when you do get pregnant with that first one, yes, you're always going to say, I'm going to get pregnant with the next one. And really the odds are you might not. And it's nothing wrong. It's just doing it again.
And the challenge is that we don't know why it works or doesn't work, because we've had so many times when it worked and we did the same way and it doesn't work, and then we change it up, and it's all a mystery. That's why faith is still the most powerful thing. Faith is the belief in the thing you desire and to see it as if it already is, and never, ever, ever let that go. And that practice is a game changer, in my opinion.
Because we actually honestly believe every one of our patients will get pregnant. The patients ask me,
what's we'll
the
have a baby,
yes,
which is the recognition that we don't know how and where and why it's going to happen. But whether you're adopting using donor egg, donor sperm, donor embryo, a gestational carrier, a surrogate, or you're conceiving with a natural means or one of the treatments we're offering, right?
Yeah. That's every single person can have a child.
April, Brittany, Christy, Anastasia, Merlene, thank you very much to everyone for their questions. At 11 o'clock, we're going to sign off, and then I'm going to come back on Instagram and Facebook. And although on Instagram, you're only going to be able to hear us, and I apologize for that. I'm still trying to work on the way to get everyone to see, but because the person I'm interviewing is going to be on my Facebook and YouTube connections. Feed, I think it is. Requested blood work. Husbands all came back normal, but his prolactin was 36. Now, what can we do? Sperm count as just 12. Well, I think add the bromocriptine, change the diet, keto will all help in those cases.
Supplements-
Did you say it's been
supplements-
repeated? Has it been repeated? Because stress can cause it to be elevated. Again, the same thing with women. Taking a shower in the morning, even though that can do it. There are other reasons why these low grade or low level prolactins can be there.
But the male molecular fertility, Kiltz's nutritional supplement liver, Kiltz's keto concepts and ideas, which remember, I'm just using my name, but ultimately it's just a label. Ultimately, what fasting is lasting, high fat is anti-inflammatory, and these ideas are really radical and amazing. And the more you do it, but the sperm can be improved. It may or may not be the prolactin at all, but I think prolactin is increased due to some inflammatory particles that get in and do it. So again, we don't have all the answers, but we're doing the best we can. 33 millimeter cyst, baseline, something to be concerned about. Estrogen at 36. I have my opinion. I say stimulate.
Yeah, that's not a functional system.
Yeah.
And even if it is, it doesn't matter because we can stimulate the ovaries at any time of the cycle. You can even stimulate the ovaries when you're pregnant, by the way. That's the amazing concept in all of this. So getting you to retrieve eggs is a whole other story, but.
Hey, Rob, can we do PGTM without doing PGTA?
You can
so
do
PGTM is for genetic mutation.
Sure, you can. You don't have to do aneuploidy, but in general, they're looking at aneuploidy and gender and looking at other single gene disorders, and they may be looking at translocation defects and things like that. So yeah, we can look at all of those. By the way,
Is there a big difference in cost? By the way,
I don't know the cost of that stuff for us. I mean,
because once you get to biopsying embryos and doing
Well-
that, you might
well-
well check everything. right?
Yeah. You can do aneuploidy testing and you can do gender as one of those. But now when you want to look at single gene disorders, the cost goes up, or you're looking at translocations, the cost goes up for sure.
Yeah.
Let's see. Key 35 had successful transfer of 238 embryos. However, when I went first time ultrasound, nothing was seen in the uterus tubes. Then HCG levels began to drop and I miscarried. I was immune 3. Recommend changing anything, or do you think it was just an abnormal embryo? Well, we have to assume the embryo was normal because we can't change the embryo, but we want to make sure we're changing the environment. Well, this is where laparoscopy, hysteroscopy, scratch come in, Receptiva, ERA, ERP, Immune 4 protocol, IVIG, Humira. And this is where I go to Plaquenil 200 twice a day, Lovenox 30 to 40 twice a day, Prednisone 10 to 20 twice a day. I know it seems crazy, but these are the things that I think really can help. Prograf. I know Dr. Corley used a lot of Prograf in the starting with transfer.
Yep. 2 days prior.
Or start with the progesterone and then stop with the pregnancy and go right to the Plaquenil. And we generally don't mix it. I know in Canada, Dr. Fruki does a little bit more mixing, but there are a little bit more complications for sure. Shannon, so all the extra testing on the PGS, by the way, cost goes up. Anything husband can do to fix morphology? Absolutely. Okay.
Right there.
The molecular fertility supplements, HCG Clomid, Kiltz's keto, fasting is lasting, light weights, light exercise, slow it down. Don't do all the heating up exercise. That cooks the sperm and the eggs, by the way.
And there's a very interesting sideline to that question. He's 29 years old. He's healthy. He has really good sperm count, really good motility, and the morphology is 3%. That's probably even normal sperm.
Well, but
What do you think?
No. Morphology or damage to DNA, cellular damage, glycation causes dysfunction. Because how many people die of diseases and they're considered healthy? So remember, if you're infertile, it's always the sperm, it's always the egg, it's always the embryo, it's always the implantation site.
Yeah.
So normal numbers doesn't mean it's not the cause.
No, but on the flip side of that is that actually in human beings, if only 4% of sperm was actually normal, we'd be extinct.
Right. But that's true. But even normal morphology doesn't mean that the sperm isn't the cause.
Exactly.
So that's really the important part to all of this. We have to make sure that even when everything's normal, unexplained, you're not getting pregnant, having a baby. We know something's wrong. We're just idiots. I call it idiopathic. You know, we call it idiopathic, unexplained.
Well,
we don't know.
Because it's a nice way of saying that we're not idiots. We are facing an idiopathic cause.
Well, but we're really blind because everything's normal. Who gets the blame? The woman. They take the brunt of the emotions and the challenges in this, and they shouldn't.
That's true.
But we need to be recognizing that it's not your fault, it's our fault. We should take full-on responsibility because we give the absolute incorrect recommendations for a healthy lifestyle. That starts right there. And what we're doing in the Fertile Secret and these concepts and ideas is that we believe as a team, you are fertile. You're having a baby. And we're bringing together all these ideas, all these concepts to give you the very best that we can figure out in all of this. And I know I got a team of really positive team members. And I call us the pride, right? We need to all be prideful that we're on a team to help each and every person in all of this, by the way. Release his sperm before frozen cycle. How many days should your husband release his sperm before a frozen cycle?
Before frozen cycle.
I'm not sure, but providing sperm for an IUI or IVF or anything, information actually suggests the more ejaculates you have, maybe daily, you have better sperm. It's less glycated.
That's what I do with DNA fragmentation, by the way.
Right. So more ejaculation. That's our recommendation for sperm DNA damage or morphology. Remember, it's all glycated cells, and that's the biggest problem. AMH of 0.08, okay for IVF. I was pregnant 1 year ago, had a tubal. It's okay. Don't use the number to say I can or can't. You got to imagine that you have great eggs, great ovaries, and you're going to do something to get something. If what you're doing isn't getting where you want, then these are where the questions come. It's like, okay, what do we need to do differently? Whether it's ovarian rejuvenation via something or stacking, or you're going to do a donor egg add-on, we can do all those things for you, by the way. We have a great team. Our third-party reproductive team, Pride team, where we are building our donor sperm program, our donor egg program, our donor embryo program, and our surrogacy program. That's really, really important, by the way. Oh, Dr. Ivanov in Philadelphia, and we work with Dr. Brandeis and other docs in New York, by the way. We'll work with your OBGYN or your fertility doctor or your family doctor, no matter where you are in this country, in this world, for sure. All right. One more question or two. Let's always give a shout out to Maria, Craig Emmerich, in their keto stuff, by the way. Get on their Facebook, their YouTube. Look at Ken Berry, Nisha Berry. Really excited. We had a great conversation with Ken a couple weeks ago. We're going to be doing, and Carnivore Cavelli, Jim Sumner's. We're going to continue our Sunday 11 o'clock conversations with others. And if you guys have other experts that you'd like us to put on to have an interview and conversation, we're really excited to do that, by the way. February consult, Mrs.
Taylor
Conway. Let's see. Email us, connect with us. We're working to get people in earlier for sure. We have a great, amazing team. We're working to get a new system to go right online, make your appointments, and get a lot more information. All right. God bless you guys. Again, I'm going to come back on live in about 5 minutes, 10 max, and interview Jennifer Waters on traditional Chinese medicine and other ideas of healing. So thank you very much. Let's see. If you go to our website, by the way, CMI Fertility, you could look at our supplements, both nutritional supplements from Kiltz and also our molecular fertility supplements. And often our other docs have other supplements ideas. We've used Theralogics, whatever. So much out there, by the way. We're not saying we're just have one way to do it. But God bless you guys.
Yep. Bye-bye.
Bye-bye.
See you guys.
It's great.
Bye-bye. Take care.